fingernail polish will interfere with the device, and so you will not get a correct reading. When you have oxygen, sometimes there's the temptation to turn it up more and more, like more was going to help you feel better, but that's not the case. We want to keep it in a narrow range of 89 to 92%. That's the sweet spot. And so using oxygen correctly will help you with your COPD if you need oxygen. One of the other treatments and therapies for COPD is pulmonary rehab. And I need to kind of point out this is not pulmonary rehab. This person is on a treadmill booking it pretty hard. Usually we're talking about gentle exercise with pulmonary rehab. You're monitored by a respiratory therapist, by a nurse, and exercise physiologist. It's a structured program for people with chronic lung disease. You develop a little bit of endurance. You don't get brand new lungs, but you're able to do more with what you have. They also have education classes that focus on lung disease, breathing techniques, diet, smoking cessation, and more. Those people who do pulmonary rehab are the ones that have a better chance of staying out of the hospital for COPD. We also stress good nutrition. We want you eating several small meals per day rather than a large meal. The stomach, when it gets very full, will push up against the diaphragm, making it very difficult to take in a breath. So we want you to eat slowly and then stay well hydrated to thin out the mucus inside your lungs. So to live better with COPD, much of this is going to be pacing yourself throughout the day and breaking up your tasks. For example, if you need to make your bed, you make half of it, take a break. Make the other half hour later. If you're doing the laundry, just simply getting the laundry into the laundry room and then take a break. Things like that. So pace yourself, break up the tasks. Move slowly. You don't have to do everything fast. Just keep moving. Sitting for a task such as putting on makeup and getting dressed for brushing teeth can help you with COPD so that you can do your daily activities without getting so short of breath. It's important to arrange your house so that the things you need to get to are available. You don't want the things that you're going to use every day in a spot to where you have to climb a ladder or a step stool. Keep it down where it's convenient. After meals, take a rest for 30 minutes before you do anything else. If you're planning on taking a shower or doing a bit of gardening or some housework, wait 30 minutes after the meal so that you can do your job better, your activities better. Shower stools with a hose for bathing are very helpful for people with COPD. They become less short of breath from all the mist and the warmth in there in the shower and are able to do that job better. Assistive devices such as long-handled reachers are helpful. There are devices to help you put on your socks without bending over. Those are all helpful with people who have COPD. Carts with wheels to push oxygen tanks or to push things that you want to carry around. Take the strain off of you. Some of the exercises we use are pursed lip breathing. Pursed lip breathing means you just breathe in through your nose to condition the air. Then you squeeze those lips together like you're blowing bubbles. And you want to blow as long as you can. What this does is it helps open up the airways that are collapsed down inside. They plump up, and then you can exhale the air long and steady. And as you blow all that air out, eventually you're going to be able to get another breath back in. And this makes it much easier to breathe, and your brain knows that you're starting to get more air in, and so you'll start to relax. Tripod breathing is another activity, and it can be done with the pursed lip breathing. And tripod breathing means you're leaning forward, you've got your hands on a table, you've got your hands on your knees, kind of like athletes after they break the tape and win a race. You can put your hands on a table, but this kind of moves you forward, moves your stomach away from your lungs so that you can breathe easier. And you could do that with pursed lip breathing at the same time. With abdominal breathing, we want to use the most efficient muscle available for breathing, and that's the diaphragm. So when you breathe in, your belly should pop out. And it's not very sexy looking, but it's very helpful because it's effective. This picture shows a lady with a hand on her belly, a hand on her chest in this manner. The hand on the chest should not be doing the moving. The shoulder muscles aren't that effective for helping us to breathe. So breathe with the belly, and you'll do yourself some favors and assist your breathing. A huff cough is helpful. When we have COPD, there's a lot of coughing that needs to go on, but if you're already short of breath, you're kind of caught between a rock and a hard spot. So most people cough by closing their throat, which is kind of difficult and takes a lot of energy. If you'll do a huff cough by not closing your throat and just blowing the air out fast and steady, you can do a cough that's much less effort. And now Rita will talk about when to call the doctor.
Thank you, Keith. So now let's talk about when you should call your doctor. So here's some tidbits on when you should call them. If you're feeling more short of breath than usual, not a bad idea to call. Now, how do you know that, right? So you're using your COPD action plan that's helping you keep track of how your symptoms are doing. Are you getting into that yellow zone now? Are you also maybe using your rescue inhalers more frequently? That's another clue that you're more short of breath. Listen to your family as well, because a lot of times they'll notice that you're more short of breath with some of your activities that normally don't bother you, but you may not realize it because you live with your symptoms every day. And we know that they have good and bad days. But sometimes the people around you will notice when they're lasting a little longer than usual. If your cough is getting worse, so either it's more frequent or it's more intense, that would be a good time to call your provider to get some additional help, especially if it's not responding to your rescue inhalers. If you have trouble with getting your mucus out, or you're coughing even more mucus out than usual, again, this is another sign that something's out of control and it's good to call your provider. If you ever cough up mucus that looks like it has blood in it, that's a given. Definitely call your provider about that one. We'll figure it out. If you get those flu symptoms, that achiness, the fever, chills, body aches, definitely call us sooner than later on that one, because within 48 hours, we can actually give you medications, if it's the flu, to help shorten the course and to make the symptoms less severe. It's not always the flu, but at least we can catch things early and start treatment, so definitely call us. If any of these symptoms are making it difficult for you to sleep, because the cough is waking you up, or you're waking up in the middle of the night feeling short of breath, having to use your rescue inhaler or your nebulizer, definitely give us a call. It's time for us to step in and give you more help. Again, follow your COPD action plan. If you don't have one, I really encourage you to talk with the person that treats your lung disease about setting one of these up. It definitely can help you keep track of those symptoms that come and go every day, good days, bad days, and help you keep track on how long those bad days are going on. And also, it gives you some guidance on what to do when symptoms are in the yellow zone. Just a reminder, okay? And usually the recommendation is to call your provider within 24 to 48 hours when these symptoms start. And if they're not getting better within that time, you should call to get more help from us. So let's review. What are your exacerbation symptoms? What are the ones you're looking for? So you're looking for more shortness of breath than usual. Activities maybe that make you short of breath normally are actually making it even worse. You can't walk as far. You can't do the things you normally do. If your shortness of breath is waking you at night, that would be a clue that something is brewing. If you're coughing more, you might have a cough every day, but if you find that the cough is becoming more intense or it's more frequent or keeping you awake at night, you need to call your provider about that. If the mucus that you cough out has changed, if it's changed in color, consistency, amount, and especially if you can't get the mucus out. Wheezing, that's another sign of a potential exacerbation. Some people have some wheezing occasionally, but they may cough or use their inhaler, it goes away, all is good. But if you find that you're wheezing more and not getting the relief that you normally get, you would definitely want to call your provider for that. How do you prevent your exacerbations? Well, one of the best ways is to protect yourself from getting sick. So stay away from the sick contacts, use a mask when you're out in public. You can also keep your immunizations up to date. And again, remember, the flu vaccine and pneumonia vaccines are not live viruses or bacteria, so you can't get the illnesses from either of those vaccines, but they're very important in protecting you from getting those illnesses and keeping you out of the hospital. The flu vaccine is every fall. Get it early enough, generally around October, so your body has time to build up the immunity for when flu season starts. And pneumonia vaccine, there's two. Pneumovax is given once before you turn 65 and one more time after you're 65 years old. And Prevnar 13 is the other one that's given once after the age of 65. Talk with your primary care provider or your pharmacy to get these immunizations. And what are treatments for your COPD? So you have your daily treatments. Those are the maintenance inhalers. Those are the ones that you're going to do every day, regardless of what your symptoms are. Without fail, you always do it. It's just like brushing your teeth. To have good dental health, you brush your teeth twice a day. So same thing goes with your inhalers. Take them as they're prescribed. Some are only once a day, others are twice a day. So just make sure you're taking them correctly and every day. And then you have rescue inhalers, and those are the ones you're going to use when you're experiencing some of these symptoms of an acute exacerbation. They come on very quickly in their effect, but they also don't last very long, where maintenance inhalers will last 12 to 24 hours. So rescue inhalers, you only use them when you need them, and you shouldn't have to use them every day. And remember, treatments include nebulizers, not just inhalers. So what can you do to help to live better with your COPD? Exercise, moving, and that's what pulmonary rehab is about. It's about helping you to move at a level that your lungs can tolerate and to increase the strength to be able to do more. If you're just sitting all day long, that's about all your lungs are really prepared to do. But if you get up and you move, even if it's just taking 10-minute walks a few times a day, gradually you'll notice that your breathing does better with these activities, and you could probably walk even further, and you might not need to break it up so much. You've got to have the lungs prepared to do the activity. So do your exercise, break your tasks up also. You know, you don't have to do everything all at once. If you're making your bed, make part of the bed, sit down, take a break, recover, and then later do the other part of the bed. The bed's still going to be there. Other things that you can do is eat healthy, get enough protein in your diet, make sure that you're well hydrated so that the mucus is thin and easier to get out. All of these things can help you to live better. And if you happen to be one of the patients that use oxygen, make sure you use your oxygen appropriately. You know, more is not always better when it comes to oxygen. There's that certain range of about 89 to 94% is where we want you to be. It doesn't have to be higher than that. All that being said, if it's higher than that and you're not using oxygen, you don't need to make it lower. But if you're using your oxygen, 94 is the max that you really have to have it. And even 92 is acceptable. So just follow the guidelines from your provider about how to use your oxygen. You might use it all day long, or you might only need it when you're doing activity. And what other kind of methods can help you to live better? Well, there's tools, such as there's grabbers so that you can reach things. There's even devices to help you get your socks on without having to bend over. You can use a stool in your shower so you can sit down, or using the hand sprayer, again, so you can sit down and shower, because bathing is actually really hard work. And if you wear oxygen, wear your oxygen in the shower as well. These can all help you get through these activities a lot easier. So when should you call your doctor? Well, that relates right back up here to the symptoms of an exacerbation. So if you find that you're more short of breath than usual, and it's not responding or going away with your rescue inhaler, if you find that you're coughing more, either more frequently or more intense, or if you're bringing up more mucus, or what you're coughing out looks different than what you normally cough out, it's changed in color or consistency, or even if you now can't get the mucus out, it's hard. These are all things that you're going to call your provider about. If you cough up blood, call your provider. And if you're wheezing and it just doesn't go away, call us. And remember those flu-like symptoms or allergy symptoms that just aren't in good control? Those can also trigger your COPD, as can reflux disease, anxiety, and depression. So if you think any of those other conditions are not well controlled, definitely talk with the provider that manages those and help them get in control, because that is part of controlling your COPD. Any questions? I encourage you to talk with your pulmonary provider about any questions you have about your COPD and your medications and things that you can do to live better with your COPD. Make sure you have that COPD action plan. That helps you to really keep track of your symptoms every day and know when to call your provider. Thank you. I really appreciate you taking the time to listen to our program today, and I hope that you find the information useful and it does help to keep you out of the emergency room and the hospital.